Getting learners to write as a form of reflection is highly beneficial and aids in retention of information. So some of the methods you can use are something called think, pair, share, where you ask the learners to think for a moment and jot down some answers, then pair up with someone and discuss their answers, and then share with the entire group. A minute paper involves stopping to ask students to write for a short period of time on a focused prompt question. The technique can be used at any point during your presentation, but it can be particularly useful when learners seem to be drifting, or as a way of transitioning between key ideas, or towards the end of the lesson as a way of encouraging learners to summarize what they've learned, organize new information, incorporate new ideas into their knowledge base, or apply the learning in novel ways. A minute paper is also a great way to end a session, asking the learners to write down what they thought was important, what were the muddiest points, and so on. Also, another way to get them to write is by using journaling, having them keep a regular journal and asking them to write in it regularly. You can provide prompts if you want. It's your call if you want this to be something they are occasionally asked to share, or something they can keep just between the two of you, or keep entirely private. I think it's a good idea to let them know when you're going to ask them to share. If they write thinking it's private and learn they have to share it, it can violate a little bit of sense of trust. And then finally, another way to get students to write is by asking them to write in depth about their best or worst patient experience, or best or worst clinical experience, and so forth. By using clinical vignettes, you also have them work on relevant information that happened to them in their environment.